Hey guys, welcome to Podiatry Practice Mastery. I want to do a little update on my patient presentations. If you've watched or listened to any of my previous podcasts, one of the big struggles that I've had is for two main diagnoses, Achilles tendonitis and plantar fasciitis. There are so many treatment options, we overwhelm our patients. And I've tried a lot of different things over the years to explain these. I've just explained it normally. I've used foot models. I've done things like that. And ultimately, what's worked best for me is making a PowerPoint presentation, which I call patient presentations on, let's say, the two most common I use are Achilles tendonitis and plantar fasciitis. Like today, must have used it 5 times. So basically what I do is I go in there, you can tell, they just tell you the history and you know it. Pain when you get up in the morning, plantar medial pain, you get the x-rays, you watch them walk, look at the x-rays with them. Then what I do is I show them this iPad where I have these videos on here and I have them watch the 10-minute video. And then I use my checklist. I have this checklist that I use, almost like a prescription pad, where I write down what they're going to do and I give them things to do. And so, 4 out of 10, I want to kind of talk about the one that bombed today. I did 4 or 5 of these today. And, the first 4 went well. I talked to them in between. I connected with them. But there was one woman that I didn't connect with. I felt like I was looking at a deer in headlights today. And I'm not sure if it's because I didn't connect enough before I showed her the video, or because I left when the video was playing, or because she felt like I was rushed, or something like that. But that occasionally happens to me. And so what I did for this one is I put it in my to-doist to call her tomorrow. And what I do, this is the way I do it. I don't know how you guys do it. I just say, I tell them, I like to be honest with people, and I say, Mrs. Smith, the thought in my head is that I might not have connected with you yesterday, or you may have felt confused or rushed a little bit. Is that what you were feeling like? I always use this way of the conversation in my head, or what I was thinking was this, versus saying that, hey, did you not understand? Were you upset at me, or did I do something wrong, or something like that? Because this woman, she did get orthotics, and she got x-rays. She's going to do some PT, and we might do shockwaves. So I talked about all that. That's one thing. The other option could be that when I'm doing my presentations, I'm just sharing way too much. I'm almost barfing on them. Okay, I'm almost like going through way too many treatment options. I'm trying to educate them, and it might be that another approach should be to, instead of showing everything that's possible for treatment, just saying, okay, this is what I think you should do in your specific case. In which case, I would just show my checklist and then just go into specifically, there's a lot of things, you can read about it, but I think you should start with this, this, and this. I would like your feedback, how you guys do it with plantar fasciitis. What works for you? Send an email to me at don@Podiatry Practice Mastery. Let me know what's working for you for these things. Do you go over everything? Do you just go over kind of what they need? Do you have phase 1, we're going to do this, phase 2, we're going to do this, phase 3, we're going to do this, and kind of have it all set out? Do you give them options, or do you say, I'm going to prescribe this for you? That's something I've heard over the years, is saying, it's essential, or I'm going to prescribe this for you. So let me know what your thoughts are. Also, if you want to do a strategy session with me, I'd love to do it. We could talk about plantar fasciitis, what you're doing, what I'm doing, and how we can help each other. Okay, guys, have a great day. Thanks.